Hi guys, Dr. Khorasani here. Today I'm sharing a case involving a young patient who came to us with pitted scars caused by stubborn teenage acne. I'll be demonstrating how I use Bellafill, the only long-term filler FDA approved for acne scars. This filler will help with medium-sized surface depressions and is much more cost-effective than traditional hyaluronic acid type fillers, which only offer a temporary solution. Let me show you how it works.
As you can see, this patient has several scars showing mild to moderate depressions. These are an ideal target for Bellafill treatment. Bellafill is indicated for mild to moderately depressed scars, whereas large, deep scars are best treated with excision. Bellafill is a dermal filler made of two components, a synthetic component of PMMA, polymethyl methacrylate, which acts as a scaffold for your own collagen to grow upon. The other component is bovine collagen, which is replaced by your own collagen in about 6 months. This treatment is typically performed every 4 to 6 weeks depending on the severity of the scars. One of the reasons Bellafill is so ideal for shallow scars, such as acne scars, is that it can be injected very superficially. Most fillers are injected subcutaneously or directly on top of the bone, whereas Bellafill can be injected into the topmost layer of the skin. This is because this product doesn't reflect light in the same way as traditional hyaluronic acid fillers. This means it can be injected very superficially without causing the Tyndall effect, which is where the skin develops a bluish tint if injected with hyaluronic acid fillers too close to the surface of the skin. These properties of Bellafill make it an excellent treatment for patients with mild to moderate depressed scars. In our patient here, you can see how beautifully we restored the contour of her skin. Come in for a consultation to see if Bellafill is the right solution for you.